Good afternoon everyone, I am Dr Pranitha. I am working as a fertility consultant at Kamineni Fertility Center. Today we will be talking about what is the difference between IVF and ICSI. Assisted reproductive techniques, they basically consist of two things, which is IVF and ICSI. There is a lot of confusion which is going on in the minds of a lot of people as to what exactly is IVF and what exactly is ICSI. Now in either of these techniques, the fertilization, it takes place outside the body in the lab in a petri dish, and the embryo is also formed in the lab. Eventually the embryo is grown for a period of around 3 to 5 days, and eventually these embryos, they are transferred into the womb of the mother. So this is how the pregnancy is achieved in assisted reproductive techniques. So what exactly is IVF? IVF is in vitro fertilization. So as the name suggests, the fertilization takes place in vitro, which is in the lab. In IVF, the eggs and the sperms, they are placed in a petri dish inside a laboratory in a favorable environment, and the sperms, they basically migrate towards the egg, and the fertilization takes place naturally due to the penetration of the sperm inside the egg. So this is how IVF happens. As compared in ICSI, ICSI is also known as intracytoplasmic sperm injection. So in ICSI, the egg is selected and the best quality sperms are selected, and in each egg one sperm is injected through a procedure with the help of a equipment which is also known as micromanipulator. So because the eggs and the sperms are selected separately, this procedure is different from IVF. In IVF, there is natural selection of sperms which is happening, but in ICSI, the sperms are selected by the embryologist who is performing the ICSI. So this is the basic difference between IVF and ICSI, but in both of them, eventually the embryos are formed in the lab. They are allowed to grow for around a period of 3 to 5 days, and eventually the best quality embryos are transferred into the uterus. So in ICSI, basically it is more helpful in men or male factor infertility, where the count is on a lesser side, which is known as oligospermia, or the motility is on a lesser side, or the morphology of the sperms is on a lesser side, or if the patient is having azoospermia. Azoospermia is a condition where there are no sperms found in the semen sample, and eventually the sperms, they are retrieved from the testes with the help of surgical sperm retrieval procedures, which is TISA or TZ. In such situations, because the number of sperms is very less, so with ICSI, it would be more helpful to inject a single sperm inside a single egg, and hence ICSI is more useful in the cases where the number of sperms is less, whereas in IVF more number of sperms are needed because the sperms are placed inside the petri dish, and there is a natural migration of sperm which is happening towards the egg in cases of IVF. So ICSI is more successful as compared to IVF, but cost effective wise, IVF is more cost effective for the patients who have some financial constraint. But as we look into the success rates of IVF and ICSI, ICSI has turned out to be a more successful procedure in both male and female factor infertility, especially in male factors where the count, motility and morphology is on a lesser side. Thank you.